Hello, everyone. Today, I wanted to tell you a little bit of a story. And it is Halloween, so happy Halloween to all those who celebrate. And this is not a spooky story. So again, today I'm going to tell you a story that started 21 years ago. A small physical therapy clinic took a chance on a painfully shy girl and hired her as a physical therapy aide. And the rest is history. That young girl was me. And as I was working in that physical therapy clinic, right away, I fell in love with the energy and atmosphere of the clinic, helping others through their rehab and their healing, and the ability to truly connect with patients and change their lives and see it happen in front of my own eyes. These were my first health and wellness mentors, my first manual therapy mentors before I even knew what that was, my first body work and energy work mentors. And it's where I first learned what a correct squat looked like and why I'm still such a stickler to this day that if you're going to be doing a squat, you need to be doing it correctly with proper form, because otherwise you can actually be making your knees and back worse. So that's something that I'm still known as the little drill sergeant for, as well as the basics of stabilization. So core, pelvis, neck. And when I was working in this fast-paced and lively clinic, it literally changed my life and allowed me to open up and opened up opportunities and possibilities that allowed me to blossom into the person that I am today. So I'm so grateful for that chance that they took. And October is National Physical Therapy Month. And it is with gratitude and honor that I'm celebrating 21 years of patient care. It doesn't feel possible when I say that out loud. But it's been a wonderful 21 years of connecting with people from all walks of life, holding their hands, knees, backs, necks, shoulders, etc., through some of the most challenging times of their lives and helping them heal. And even to this day, I'll be somewhere and a patient from 10, 15, 20 years ago will see me and recognize me, and they'll say, "You were the one who helped me with my knee, and you were the one who helped me with my back, and you were the one who helped me learn how to do that squat properly, and you were the one that taught me that the secret to back pain is your butt." These are some of the phrases that I used to frequent quite often when I was in that clinic for full time. And my passion grew throughout school and as I was working. And then I specialized and became a fellow of the American Academy of Orthopedic Manual Physical Therapists. It's a big mouthful of words, but essentially what that means, it's a hands-on practice called orthopedic manual physical therapy that's used to mobilize joints, tissues, and even the energy of the body for optimal movement, healing, and health. This is also called body work, hands-on treatment, etc. It's a combination of, you can think of it as some massage, some chiropractic, some osteopathy, and again, hands-on mobilization and body work. So I just want to take a moment of gratitude for all of my mentors through the years. Again, from those mentors at my first job as a PT aide who already started teaching me some of the manual therapy and where I saw it in action, to the therapists that worked in the clinic where I worked during college and throughout school, as well as the mentors that I had during residency and fellowship and beyond. Thank you so much. And I love orthopedic manual physical therapy. Hands-on work was my first passion. And after my daughter was born, we experienced significant health challenges. And I was able to experience the power of integrating a holistic approach into my already holistic physical therapy background. Because that was the beauty of it, is in physical therapy school, we learn a lot, right? It's a doctorate level program. So we have the medical background. We go on clinical. I did a residency and a fellowship. We are highly trained, and we don't, for example, prescribe. So I knew about pharmacology, and I knew the interactions to look out for. I knew the signs and symptoms of side effects to look out for, etc. However, I was never indoctrinated in that belief that, okay, if you have this symptom, this is the medication that you need to give. And I'm so grateful again for that background, because as physical therapists, we work with holistic approaches, our hands with movement. And so after my experience with my daughter, and by integrating this holistic and integrative approach, which I'll talk about more in just a moment, this is what finally allowed us to start healing and making progress on our journey. And so since then, that experience, I've combined gut health, holistic nutrition and nourishment, integrative detoxification, emotional energetics, nervous system regulation, and decoding the body with my healthcare and physical therapy background, creating a unique perspective and an ability to relate directly with patients and clients with profound empathy and understanding, and for true healing. These are the pillars of the Radiant Health Protocol that I co-created with the Divine, because that's an aspect that is so important in the Radiant Health Protocol as well, working with our higher power. And through the years of working with the Radiant Health Protocol and integrating all of this amazing, powerful protocols and approaches, I've had the privilege of helping individuals with pain, sometimes without even putting a hand on them, through virtual sessions, through in-person sessions where we didn't even need body work. Because when we work with the Radiant Health Protocol, we're working with root causes. And when we work with those root causes, we can identify that potentially their low back pain of 30 years was actually emotionally and energetic in nature at the root. And by working on the emotional energetics, working through that in just 15-20 minutes, we can get a release of pain, a release of tension, a release of tightness, a release of constriction. And after weeks of following up and teaching this client the tools to continue that work, she was still pain-free after 30 years. And then there are clients that we identified that their chronic pain or fatigue was due to inflammation in the body from their diets, from toxin exposure. And by working with them, modifying their diets, decreasing their toxin exposure, helping work with their innate body's detoxification pathways, we were able to get them pain-free. And then the wisdom of our body sometimes protects areas with pain or fatigue, right, globally, to prevent further damage. It's our body communicating with us. It is our body giving us a message. And when we can decode the body and decipher its messages, do you know how powerful that is? Because no longer are pain or signs and symptoms an enemy. It's not something that we see as bad. We see it as our body communicating with us, and we start to uncover those underlying messages. We start to see, what is it that our body's telling us? What is it that we need for alignment? And this can be on all aspects of our lives. And this is something that we dive deep into in the Holistic Detox program, which is happening right now. If someone is interested, if this resonates with you, you can jump in. And if you're watching this video later, we do it throughout the year as well. So you can just put Holistic Detox in the comments and I'll get you information about that. And that is really the beauty of this holistic and integrative work that I offer. Because sometimes we do need more of the hands-on body work, because our body keeps the score. So we may need to address the structural aspects of our body. We may need to release tension within our body. We may need to mobilize joints or fascia or soft tissue, whatever it may be. and usually a combination of all of them, quite honestly. And I pull in aspects of myofascial release, craniosacral therapy, as well as joint mobilization, as well as energy work. And I remember this one patient, again, years and years ago, that I was doing some myofascial release on him. And he had such a profound experience. He got off the treatment table and was just, oh my gosh, I've never experienced anything like that. He wrote me a glowing review online. And the beauty is that I didn't realize what I was doing at that time, but I was actually incorporating energy work into that treatment without being fully conscious of what I was doing. But my consciousness and my partnership with the divine was helping him have that experience. And so sometimes, and most of the time, when there's a structural component, we also need to be conscious of and modify the ways that we're moving, our patterns of movement, because that has an effect on those joints and tissues that are becoming restricted and tight or hypermobile and moving excessively. So we need to learn how to be conscious of our movement patterns. We need to learn how to be mobilizing what needs to be mobilized and stabilize what needs to be stabilized. So this comes into play with people that are very flexible or may have Ehlers-Danlos syndrome, etc. This is where a unique and custom protocol and plan is necessary to develop for each person. And that's just the physical, right? Sometimes and often we need to integrate and process emotions and old wounds or traumas that are still living within our body. Sometimes we have stagnant energy to release because our body does keep the score. All of our experiences from our past live within our body. If we don't integrate them and process them, emotions can become trapped within us, within our field, and manifest as physical pain, fatigue, fibromyalgia, etc. And again, when we work with these energies, with these emotions, we get true resolution of symptoms of pain. We improve quality of life and function. And these are the root causes. This is what's underlying the pain. The pain is just one aspect, one sign or symptom, one way of communicating with us. And when we, again, identify and address the root causes, we get true resolution. And again, I remember when I was working in the clinic and there was a group of patients, not, at one time, but just, sprinkled throughout. I can still see their faces. I can still feel the pain that they were experiencing. And they just didn't seem to get better no matter what I did. And at this point, I knew my orthopedics. I knew my manual therapy. I knew my stuff. I had completed all of this training, all of this specialization. However, I was missing all of the other root causes. They weren't in my awareness. They weren't in my consciousness. And quite honestly, in that setting, as most physical therapists do, we don't have a lot of time. Most physical therapists have 15, maybe 20 or 30-minute blocks of time, where sometimes, unfortunately, they may have multiple patients at the same time. And I knew that wasn't the level of care that I wanted to provide. And especially learning about all of these root causes. When we want to do a proper job, it doesn't work that way. We can't do emotional work in 10 minutes and just send a person on their way and imagine that they're going to be great without teaching them the tools, without sitting with them consciously. This is not just being sent to go on the bike or here, lift this weight 10 times or do this band exercise 10 times. This is way beyond that. And this is why this works. This is why, because we're digging deep and we're understanding the reasons behind the pain or symptoms that are showing up for you. So again, there was this group of patients that just didn't get better no matter what I was doing. And I just remember being perplexed. Like joint-wise, I was treating them. It should be getting better. Tissue-wise, I was treating them. Fascia-wise, I was treating them. And I could see that they were suffering. Their pain was real. even when other providers didn't believe them. And it broke my heart because I felt like I was failing them at the time. And I'm giving myself lots of grace and forgiveness because we can only do the best with what we know. Because now I know. I can see now that their pain was emotionally, energetically rooted, that it was diet and nutrition that was creating the inflammation for them, that it was spiritually based, that it was nervous system dysregulation that kept them in this spiral. Because when our nervous system is dysregulated, we can be doing all of the things and they won't make a profound difference because we just shift right back into dysregulation, into fight or flight or a stress response. So when we do this work with the Radiant Health Protocol, we address the root causes in small and powerful shifts. And that's how we make a profound difference in healing, and we can access true healing and resolution. Because our body is quantum. It is a universe. Everything is interconnected. So your mental and emotional states are tied to your low back pain, and your nervous system regulation is tied to your low back pain. And your diet and nutrition is tied to your low back pain or chronic knee pain or neck pain or headaches or whatever it may be that you're experiencing. And so that's why it is with great pleasure I'm so excited to offer this holistic and integrative approach to physical therapy, pain and fatigue treatment in Farmington, Hartford, and Wallingford, Connecticut, and soon Western Massachusetts. And I also offer virtual sessions and care worldwide. So if you're interested in this, go ahead and just put consultation in the comments or click the link below and learn more about how this approach can absolutely change your pain, your treatment experience, and your quality of life overall. And the other thing that I mentioned earlier is that doing the work for 30 minutes, in a session like most physical therapists do, and I don't blame them, that's the system. That is the paradigm that they're working within. Again, they're doing their best that they can as well. And I know some fantastic manual physical therapists in the area that do that work. And then I can be an adjunct. I can be that extra provider to start working on the other root causes, the gut health, the emotions, the energetics, or I can do it all with the hands-on, especially in person. And that's what I mentioned, is that my sessions are 90 minutes. We go deep during these sessions. It's not a quick, all right, do this exercise and see you later. And at the same time, I provide concierge and ongoing support and care. Because with a consultation, you also get multiple days of troubleshooting. So you get to ask Q&A. You get to, again, say, hey, I tried this, it didn't work. Or, hey, I'm doing this and I forgot how to do this. Or I need help, figuring this out. Or, this happened, now how do I apply this? That's the part that is missing in a lot of treatment. Because yes, you're going to get some exercises to do. Yes, you're going to get some tools and strategies to practice. But how do we create accountability and support for you during your busy lives while you're going through this journey? Because when we have pain, everything else takes a background, right? Is in the background. Our pain is in the forefront because it affects everything. Our business, our career, our family lives, our parenting, our social life. We want to take care of this in a way that is going to get true resolution without invasive treatments, without medication use, without long-term, again, opioid use and all of the other things that are such an issue in our society today. We can use food as medicine. When we balance our gut health, our gut microbiome, that is literally a built-in pharmacy that we have that can secrete opioids for us when we have pain to help manage our pain. We don't need the external things. We have it within us. Our body is wise. It has innate wisdom. It has innate knowledge. And when we support our body to work the way that it needs to, then everything improves. And I'm talking about pain today, and the Radiant Health Protocol is applicable to any conditions. I have free masterclasses for those who'd like to learn more about this approach. So go ahead and just put PT in the comments, and I'll get you signed up for that free Radiant Health Masterclass series. And you'll also be notified when I host my free masterclass on pain, specifically on pain, fatigue, and musculoskeletal and neuromuscular conditions coming up in a few months. And you can also take a look at the full list of masterclasses. It ranges everything from fertility to weight loss to, again, autoimmunity, to hair loss I have on there, to hormone regulation, to colic, eczema, and reflux in babies, to digestive conditions. When we work with the root causes, we get resolution for so many conditions. Because oftentimes when we do have, let's say, chronic low back pain, there's stagnant energy in our abdomen, which typically will manifest in digestive conditions, more than likely some constipation, maybe IBS symptoms. Maybe it shows up as painful periods for you if you're a woman. So this is the power of this protocol. Again, for those who are interested in learning more about a consultation, go ahead and put consultation in the comments. And especially for in-person, you get a full month of support with each consultation. So you get access to the Radiant Health and Wellness Mastermind, which is our private community where there are trainings and live group programs and live group sessions all throughout the month, resources, step-by-step protocols, guides, cooking shows, recipes, so that you have everything that you need for your health transformation and to thrive. And again, for those who want to work virtually, you have the option to access that as well. So I would love to answer any questions that you have today. Again, so happy to celebrate National Physical Therapy Month. And as always, I wish you and your loved ones all the best, and I will see you in the next videos.